We all good. Look, thank you for being here today. I have been in public life for over 40 years, and I have never seen such an administrative stuff up as the vaccine rollout in western and far western New South Wales. In fact, I am really concerned about the preparedness of the government for vaccine rollout across Indigenous communities right across this country. We see today something like 98 additional cases in the far west of New South Wales, 53 in Dubbo, and an additional amount in far western New South Wales. There are 7 new cases in Wilcannia today. And what really worries me is the growth in the number of cases in the township of Burke. It's gone from 3 yesterday to 7 today. And I am very worried about what's going to happen in terms of Burke. I've been advised that in the western suburbs of Sydney, a very esteemed Aboriginal elder who is 99 has also got COVID. He wasn't vaccinated. Now, how can this be the case? The issues I put to the government today are these. What is the capacity of hospitals, particularly intensive care units, in the Western Division of New South Wales? John Barilaro himself said in the press conference this morning that people were being medevaced to Sydney, or he would be surprised if that was not the case. So what we want to know is what is the capacity of hospitals, particularly intensive care units in Western New South Wales, and what are the plans if people need to be evacuated? The second point is this. In budget estimates spillover this morning in the federal parliament, the health department said that they are going to have a massive vaccine rollout to 30 Indigenous communities. They couldn't say what communities, and 30 is not going to cut it. It is just not going to cut it. There are many more than 30 communities that are vulnerable in Australia. And the other point is this, of course. How on earth can the Morrison Government claim that First Nations people were a priority group when we are seeing the mad scramble that we're seeing now? And it is a scramble. So what are the plans for a national rollout? What are the plans in Western New South Wales for evacuation? What are the plans for rolling out to other communities across Australia? Have those other communities been identified? And if so, tell us what they are. The issues for First Nations people, we all know. Overcrowding, poor health status, and the list goes on. These are absolutely fundamental to the planning, if there has been any planning, the modelling, if there has been any modelling, for vaccine rollouts across Aboriginal and Torres Strait Islander communities in Australia. And the final point is this. There is daylight between the vaccination rates in First Nation communities and the vaccination rates across the community. What does this mean? There is daylight, absolute daylight, between the vaccination rates in First Nations communities and the vaccination rates in the broader Australian population. Has that been factored in to the Morrison Government's national plan? I have no idea, but these are the questions that the Morrison Government needs to answer. They are responsible for vaccine rollout. They have failed. And if there is an example of that failure, it is with First Nations communities in this country. Lorena.
Yes, thanks, Linda. I have a question about something that Ken Wyatt said in Parliament yesterday afternoon, where he said that there has been planning that's been done with the Indigenous group who advise him, and he named a few of those
Yes, he did.
amazing people. He was, I think, implying that a criticism of the vaccination rollout is a criticism of their advice. I misunderstood. But what do you think of, I mean, he is saying that planning has been done based on advice that they have given the government.
The response I had to that comment is that I have enormous respect for the people that make up that strategic advisory group. Enormous respect. I have enormous respect for Nacho. I have enormous respect and thank God for the Aboriginal health organisations that are doing such an amazing job in many of the First Nations communities. It is a cop-out to say that criticism of the vaccine rollout is criticism of that group. My criticism is squarely at the feet of the Morrison Government on why wasn't this thought about? Why isn't there a national plan? And if there is, please tell us what it is.
Is that all, Lorena?
I have another, but I'm not sure if, is it Jade wants to ask any questions?
Jade, how would you like to ask your questions?
Okay, so I have a follow on that.
Sorry, Jade's asking questions, but
Yes.
she's on a...
I can hear you. I just find that absolutely appalling. Not only are people being hospitalised because they need to isolate, but I am aware that children were being admitted to hospital not because they were sick, but because they had nowhere else to go. Now, hospital beds, we've got a plane going over. Sorry.
I can hear it over here.
I'm just responding to Jade. Jade, I'll start that again because I think the plane, which is even louder now. So your question was about people being hospitalised so they could isolate. Yeah. One of the really big issues in the communities that have been affected is the capacity to isolate. We're not talking just about people with the virus, but people that are close contacts. The overcrowding is chronic, and people using hospital beds to isolate just shows me the shambolic nature of this so-called rollout. The other point that I've been advised of is that children who are not sick are being admitted to hospital in Dubbo because they've got nowhere else to go. Now we know what the hospital strains are. I'm asking questions about capacity. There should not be a situation where children and adults are being admitted to hospital because they don't have anywhere else to go or they have to isolate. Anything else, Jade? Yes. I have ideas about what those 30 communities might be, but the upshot really is that 30 is not going to cut it. There are many more than 30 Aboriginal communities, both discrete and urban communities, across Australia. My question is, well, what about those communities that don't make the list of 30? The idea that they're prioritising 30 communities, I would like to see the modelling, I would like to see the logic, and I would like to see the names of those communities. Lorena.
Yes, I have a question for you about opening up. So the Premier again this morning was talking about all of the great things we'll be able to do when we get to 70 and double dose. But as far as I know today, no one has yet explained whether that means 80% of the Aboriginal community, for example, or 80% of aged care. What's your view on at what point we should be opening up? Should we be opening up New South Wales before, Aboriginal communities have reached that level?
Lorena, I hear the discussion about opening up, and I understand the Premier of New South Wales is advocating that very strongly. But I do make the point that there were 12 deaths in New South Wales overnight and over 2,000 additional infections. It is obviously important for people to know what the future holds. There is so much uncertainty. But the thing that I am 100% focused on right now, it's what's happening to First Nations people in Western and far Western New South Wales, but importantly across the country. That's the answers that we are looking for.
Thank you.
Thanks, guys. Just in time, the new plane's coming over.